I generally tell men when we are doing a vasectomy reversal, the process of this surgery means that I don't know what connections I'm going to make when we go into surgery. That means that when a vasectomy is unplugged, I look at the fluid that's coming from the testicular end, which helps me decide what connections I make. In the event that the fluid coming from the testicular end is nice and clear and we see sperm or sperm parts on a microscope, we typically make what's called a vas-to-vas connection or a vasovasostomy. This connection, when made, carries a very high success rate of 90 to 95%. In the circumstance that the testicular end has thick fluid coming out, meaning that the man has developed a secondary blockage, we have to do what's called a bypass procedure or a vasoepididymostomy. This generally carries a slightly lower chance of success in the range of 60 to 65%.